More people are taking more prescription drugs than ever, and it seems as a result, we may be medicating our water supply as well. A study out today finds rising levels of pharmaceuticals in our taps, coming out of our taps, in our drinking water. And Louise Martin on the story for us. That's a major concern.
It is, Heather. So if you're taking medications, it turns out it's likely ending up in the rivers and lakes and also ending up in your drinking water. So essentially, if you're taking medication, we all end up taking that same medication. So this was a quietly released Canadian study. So we're looking at things like painkillers, blood thinners, hormones, chemotherapy drugs, even cocaine, and other things. Excreted drugs that pass right through most sewage treatment processes and end up in rivers and lakes and then ultimately in our drinking water. So this was quietly passed last month, this Canadian study. It reported record-breaking levels of 3 pharmaceuticals in particular in river water in southwestern Ontario. Now, the levels of these 3 substances, they were a diabetic drug, acid reflux medication, and a diuretic, are measured in nanograms per liter. So the amounts are very small. But what's new is that they have never been found before in North America. So that is raising alarm bells. Why? Well, it seems that 2 things are happening. Better detection, so the methods of being able to detect these substances in water are better, and people are taking more and more drugs. As the population ages, people require more medication, and these medications are ending up in our drinking water. Now, back in February, Environment Canada officials told a Senate committee hearing that more than 165 individual pharmaceuticals and personal care products have been identified in water samples as of this year, Heather. So certainly, when you think about how many different chemicals are ending up, that's a bit alarming.
Well, it is. It's not the most pleasant to think about, but it makes sense. We would excrete those, and then the water treatment system, this is so interesting, doesn't filter them out, doesn't get rid of them. So what do we know about the impact then that has on all of us who drink the water?
You're right, Heather, when you talk about the water treatment plants, they don't filter out pharmaceuticals right now, and there really is no national drinking water standards for pharmaceuticals at this point. So there's already been an impact on fish that we know of. Scientists have proven that the drugs are creating intersex fish, meaning that males are developing eggs in their testes, and that's putting some species at risk. No one knows, though, what the health impacts could be on humans. We know the levels are low, scientists say that, but what about this sort of pharmaceutical cocktail over a low dose over a longer period of time? What could that be? What impact could that be on health? So that's the big question that these findings evoke. And as I mentioned, most water treatment plants don't filter out these types of drugs right now. So is that something that will be looked at in the future as well, given these findings?